Welcome back. You're watching McLaren Port Huron's Today's Health, and we're talking about stroke with board-certified neurologist Dr. Marwan Shuayto. Okay, let's talk a little bit about how you make a diagnosis when there's all these different areas of the brain and all these different symptoms.
Well, that's a very important question. Usually that's done by very trained staff. I mean, our EMS here in Port Huron and across the state really do a wonderful job in recognizing symptoms. I mean, sometimes the 911 call is, you know, hey, I'm having a stroke or someone's having a stroke, but sometimes that's not the case. And our EMS crew recognize symptoms, and also our emergency room physicians play a very big role in noticing the symptoms of a stroke. And then the stroke is, like we said in the beginning, whether it's a bleeding stroke or a ischemic stroke or decreased blood flow to the brain stroke, obviously the treatment is totally different. So it's important to recognize whether this is a bleeding stroke or a non-bleeding stroke, and this is where the CT scan of the brain comes in. So to be a stroke certified center, you have to have a 24-hour CT scan available, and this is available here. And also certain labs have to be done. But the most important thing is the actual physical exam.
What are the treatment options then if it's determined you have had a stroke?
Well, this is where, again, we urge patients to seek immediate medical attention because there is a therapeutic window. It used to be a 3-hour window. More recently, it's been expanded to a 4.5-hour window. So if symptoms occur within this period of time, we can treat with a blood clot busting medication like TPA. Beyond the 4.5-hour window, it becomes much more risky of having bleeding in the brain. So that's why we put a cutoff of 4.5 hours. If someone presents beyond the 4.5-hour window, then it's basically conservative management and at the same time working on lowering the chances of having another stroke.
Who's most at risk to have a stroke?
Strokes can occur with any patient, but obviously, yes, there are a lot of things that can increase the risk factors of strokes. The most common or the factor that influences increasing stroke risk the most is hypertension, so high blood pressure. Uncontrolled high blood pressure is by far the #1 cause of strokes in the United States. To give you a simple example, lowering your systolic blood pressure, which is a higher number, by 10 points, and lowering the diastolic blood pressure, which is a lower number, by 5 points, can reduce the chances of having a stroke by 40%. So especially when it's something as easily to control as, you know, changing diet and blood pressure medications, that's a very important thing to treat.
What would you like to see the blood pressure stay at?
Now, normal blood pressure is obviously 120/80, but as far as being called hypertensive, it's more 140/90. But we don't want the blood pressure to be too low either, because one of the strokes is a hypoperfusion stroke, which means low blood flow to the brain because the whole blood pressure is too low. So I like the blood pressure to be around 120/80. So that's pretty much it. Other risk factors are high cholesterol, smoking. Smoking is the second most leading cause of stroke behind hypertension. Family history plays a role. There hasn't been actual genetic testing as far as we can test your gene to see if you're at extremely high risk, but family history plays a role. And obviously personal history. So if you've already had a TIA or a transient ischemic attack or a previous history of a stroke, then you're at a higher risk factor for having a stroke. And a TIA is a stroke, but the blood flow is sort of restored before permanent damage is done. So usually symptoms resolve in clinical practice in about 2 to 3 hours, but textbooks 24 hours. So stroke symptoms that last less than 24 hours are labeled as a transient ischemic attack, or the public names it a mini stroke.
But it's still important if it's a TIA.
Correct.
To call 911?
It is, because it could be a warning sign of a bigger stroke to come, or it could be that you need immediate workup because you've already had a TIA, so now your risk of having a stroke is higher. Other things that can increase the risk factors of strokes are cardiac conditions. If you have heart disease, you're at increased risks. If you have arrhythmias like atrial fibrillation, you're at an extremely high risk for strokes. Those patients have to go on anticoagulation or blood thinners. Medical conditions like diabetes and heart disease, and certain inheritable diseases like sickle cell anemia, very high risk factors for strokes.
So how important is it to control the risk factors that you can?
It is extremely important because, like I said, just lowering your blood pressure a little bit, does a lot for the risk factors dropping down. Sometimes, unfortunately, it's too late when we see someone who's paralyzed on their right side and have not seen a physician in decades, even though they're in their 50s and 60s. But just because you don't have symptoms, it doesn't mean you're absolutely perfect in health. So high blood pressure that's untreated, it can be treated easily. High cholesterol can be treated easily. Stopping smoking is extremely important, especially when you have so many routes of aids with us now, with medications, patches, and even programs like we have here, No Buts About It, I believe it's called. So this is also important. Now, some things we can't change, right? So if we're above the age of 60, unfortunately, we can't change that, and we can't change our family. So family history, that's something we cannot change.
Well, this has been some really important, life-saving information. Do you have any closing comments for our viewers?
Just the urgency of seeking immediate medical attention. Unfortunately, so many times I hear it where, yes, the symptoms started yesterday, but I thought I'd sleep it off and I'll be better in the morning. Like we said before, that takes us way out of the treatment windows. So as soon as patients feel anything abnormal that could be a stroke or even something else, it's a sudden onset. So this isn't something that's starting a week ago and gradually getting worse. This is everything is fine now. All of a sudden, it's not. Call 911.
Thank you so much for joining us.
You're welcome.
Stay with us. We'll be right back.